The mission of MyOrthoVA is to empower orthodontists and orthodontic practices with a new solution for staffing. Traditionally, when we hit a staffing challenge, we would hire more highly paid employees who would hopefully deliver the results that we needed to help to manage and staff our practice. MyOrthoVA has been built upon the digital foundation of being able to access our offices through digital media such as a voice over internet phone or a computer. And what that means is that our employees are now geographically free to work in our practices from anywhere in the world. At MyOrthoVA, we staff our practices with highly trained, wonderful employees from the international community, mainly from the Philippines and from Latin America, virtual assistants who have expertise and experience in the medical, dental, or other fields who are going to be working for the practices full-time in a remote context.
One of the major pain points as a consultant and the practices that I was working with was they're on board to execute and implement new things, but they just simply don't have the capacity. I knew that if I could get involved and refine the VA experience for the orthodontic practice, it's really going to be a slam dunk for most, if not all, offices.
It's a marriage of two things. One is that we've had a digital evolution in orthodontics, and so much of what we do, both on the administrative part of the practice as well as the clinical side, is now digital. And when something is digital, that means that it can be accessed from any computer, from any VoIP phone, whether that computer is sitting inside of your office or outside of your office. And so suddenly, digital opens up options for our staffing. We finally have this opportunity for people to work in our office that aren't physically inside of it. That was the first major aha moment.
Think of your growth guidance or observation follow-ups. Think of active patients without a future appointment. Financials, you have long-term pending. How many times does the treatment coordinator actually have capacity to follow up? What I have been excited about is creating the training program, creating the onboarding to really make it as seamless and smooth as possible for the practice to really take a VA and have the VA be successful early on in their onboarding.
MyOrthoVA is a collaboration of orthodontists such as myself, professionals from the orthodontic consulting industry, such as our COO, Casey Bull, and advisors from the general industry, such as our advisor, Chris Benson. And we're able to take that shared knowledge and those varied perspectives and put together the proper training for the VAs so they understand what those processes are.
When you have an orthodontic team member in your practice that's locally based, depending on their hourly income, the total cost to the practice could be anywhere $60,000, $70,000 a year. For a fraction of that, you have this remote team member who is so dedicated and well-trained.
If I could speak to every orthodontist or orthodontic practice in North America or in the world, I would tell them, stop trying to reinvent the same wheel. Think about a different solution and think about how our world as orthodontists has changed.
You can hire MyOrthoVA full-time. They're highly skilled, they're dedicated, they're committed, and their wage far exceeds what they have the ability to earn locally. So it's a win for the VA, it's a win for the practice, and it's a win for the patients because the patients have easy access to the team more consistently.
My vision is that staffing will no longer be the greatest challenge for orthodontists. I want orthodontists thinking about smiles. I want orthodontists thinking about teeth. I want them thinking about the relationships that they have with their patients.